Okay, so it's not that we got scrambled, and I think I'm so grateful this morning. I was thinking, these are my people, 100%. I'm so grateful for the leadership panel because this question, I think, was already made obvious by that panel of how did we get from resource stratified, resource relevant, low resource settings to talking about AI. So this morning we talked about the first two objectives, collaborate instead of compete, a central repository, and we will iteratively continue to improve those things. And then now we get to focus on 3 through 5, which is quite ambitious in scope and asks us to do something harder and bigger. Over the last year, I've had the opportunity, after reflecting on everything we learned at the first year, we went around, and again, thanks to Zoom, you can do that. We went around the world asking people, but you've got to have a solve for this. You've got to have a solve for this. We talked to people at the WHO, the DOD, et cetera. And I think that the story that sticks with me is, you've got these people spending years and years and years of time. And then the example from the WHO is then you get these products that are literally lining the walls of the offices in Geneva. And then if you ask the person whose job it is to get that clinical guidance out to the people at the tip of the spear, they say, well, localization is complex, and that's a national responsibility or a local office priority or responsibility. And then acknowledging is, if the folks in Geneva don't have the resources to do the complex process of localization, the clinical officers, et cetera, in that space likely don't have the resources to do so either. And so have asked that question of lots of people of like, yes, that's a great gold standard. Yes, that's a great process. Let's talk about pragmatism and scalability, and got lots of. And so then we process mapped the approach and said, okay, so no one can give us an easy answer that we can just go, great, we'll bring you to the next conference, tell us how to do it, we'll follow your lead. And so we said, where are the bottlenecks here? Where are the things that are really labor intensive? Where are the things that are slowing us down? We lived in Malawi for a year, and mangoes were everywhere and incredibly cheap in one of the world's poorest countries in the world, where they are constantly hovering on famine. They meet the definition X number of years, but they're always just barely there. And then you go to an organic grocery store and pay $16 for 6 ounces of dried mango. And you go, I know those resources aren't equitably getting back to the producer. Where are they going? Where's the slow part of this process? Where is there an opportunity to accelerate, increase impact, and importantly, increase equity? And in this conversation, a lot of our content generators are in the room. And so and this is a lot thanks to our colleagues at BCG who are donating their time, process map this approach. I also just barely graduated from a graduate certificate course recently. I literally was calculating what's the lowest score you can get on this test to pass, but took a formal graduate course in engagement. So same deal. These are the people who are writing the books on how do you engage people and get buy-in. Basically, Delphi method is something we're familiar with. We recognize that Delphi is a tool that doesn't make us all of a sudden go, aha, I understand how I could make 100 difficult decisions with 50 different key partners and have it relevant at the bedside. And so science generally said, yeah, we don't have it solved either. And so we process map the approach, and this is kind of what we would say is happening today-ish. And this is a line, not a circle. We know that ultimately we're aiming for a circle, but if we just look at content generation being pushed out, those are the highlights. And then we say, where are our bottlenecks and where are opportunities for scalability, efficiency? And so you've already heard about this morning, and I think this will be not novel to many of you, of Gen AI can't parent your children, it can't, there's a lot of things it can't do and it shouldn't do. But again, one thing it can do is identify a bunch of information, code it for you in a decipherable way, and produce it so that, like Dr. Bolger articulated this morning, humans get to operate at the top of their scope and say, this works, this doesn't, but a machine can do the thing that a lot of us have been doing by hand. And we have some really awesome examples of that in the room that we get to hear from this afternoon. And then I already framed us in the dissemination implementation science. We recognize that, I probably told this joke to you, but I got to tell it from here. One of my friends lives in Wisconsin, and his dad calls the small planes doctor killers, because doctors think I could take out an appendix, I could probably figure out how to fly a plane. And there's a lot of expertise out there that we don't have. And so dissemination implementation science is largely a science that is adopted, to use a generous term, from other sciences like behavioral economics, marketing science, strategy. Like, we work with people in other sectors and they go, oh, I'm already doing that. You just layered on some jargon to that. And then this has been part of our framing since our grant application. The agile methodology is to simplify and maybe distort it, is an approach that came out of the software industry where they realized we're spending $1 billion on something, and by the time we're ready for market, the market has changed and the product is irrelevant. So how do we change our approach so that we can be agile and therefore more relevant? And that has been a guiding principle for us, that we value individuals and interactions, these moments, thank you for being here, over processes and tools, working products or prototypes. Thank you again to Neil and Mark for sticking your neck out there. Like, we have to have something to respond to, reflect on, to know what we want to do next, over comprehensive documentation, end user collaboration over contract negotiation, and responding to change over following a plan. And so we value the things on the left, but we value things on the right, but we lean into those on the left. And so if we look at how we might approach this in the future, this is what we're going to go through in detail for an hour tomorrow. So like, you'll get to use your phones and do the survey again, if you like that or don't like that. But we'll have you reflect on, okay, here's how we posit this stage could go. What works, what doesn't work about that? And we'll go through this. But the things that we emphasize as a little different is being bedside ready or anchored in clinical decision support, and not narrative summaries that are interesting, informative, but still leave me saying, what do I do? And then the approach is this asynchronous, synchronous approach, where instead of having to get everybody together for a million hours, we have some tools that allow you to quickly go through and identify where you already agree and spend your time on the stuff that you don't. And then again, an emphasis on point of care. And so you'll get all in the weeds on this tomorrow. This is how we've layered out how we can use the tools that exist and combine those people, processes, and tools to serve our patients better as a prototype. And then the last piece for me is, I think this is really salient, that like, we hear it on the news of like, it's scary and terrifying. And people who know about this are writing to suggest that, I usually just read the title of a book and then quote it like I've read it. This one, I've barely even seen the title on somebody else's nightstand. But that people who know about this say that, yeah, it is concerning for a lot of fields for AI, but healthcare is one where really it might just blow us off of improving equity and outcomes. And that's if we do it right. So in electronic health records, a lot of partners here have educated me about this. When is Matt Burton, I think, and his colleagues at Smile CVR, I'm going to steal their language now, of that when electronic health records came on the scene, it was essentially a land grab by private companies. And so we ended with something that's okay, but it's not patient-centered and it's not provider-centered, right? Like, you can't move from one institution to another as a patient and get care where those can communicate, et cetera. This is a moment where AI might make things worse, or it could make things better. And if we participate as people who have taken the Hippocratic Oath, many of us, or other types of providers and investors in the patient experience, who are anchored in making those outcomes in patient favor, we have an opportunity to kind of bend that.